Hello, the title of the presentation is Perceptions Concerning Social and Healthcare Services Among Romanian Older Persons, and the authors are Mihaela Ghența, Aniela Matei, and Elen Silvana Bobernat from the National Scientific Research Institute for Labor and Social Protection. First of all, let's see what is the structure of our presentation. We have the social services, healthcare services, and social exclusion. Then we have the methodological approach, objective, sample, data collection. The third part is dedicated to results, and we end with discussion and conclusion. First of all, what is social exclusion? Social exclusion is not only a multidimensional process, but it's also a dynamic process that involves agency. Social exclusion involves on one side social resources consisting in the political, educational, and civic rights, or in the resources, rights, goods, services, relations that the majority of the individuals in the society have access to, or in the ideas and behaviors that the society considers as normal. And on the other side, a group of individuals deprived in various degrees of these social resources. Based on the previous literature, Walsh and colleagues grouped the indicators of social exclusion in later life in 6 main categories: economic exclusion, institutional exclusion, territorial exclusion, symbolic identity exclusion, exclusion from meaningful relations. According to some authors, the access to social and health services are key components of social inclusion, especially in later life. Based on the scientific literature, we can conclude that the access to health and social services, as well as the access to basic services, are very important in terms of social inclusion of older persons. The objectives of our paper are to get an insight into the availability of social and healthcare services within the community from the perspective of older persons, and to assess the quality of social and healthcare services based on the satisfaction of beneficiaries with the services received. In terms of data and methods, a face-to-face questionnaire survey was designed and applied to assess the perception of older people. The target population was represented by Romanian uninstitutionalized people aged 65 and over, and the total volume of the sample was 802 older persons. A stratified random probabilistic sample was used with a margin of error of plus minus 3.5% for the national sample. In terms of data collection, this took place in November 2021. Let's see the results of our research. Perception with regard to the availability of social and healthcare services. We observed that over half of the respondents consider that social and healthcare services available within the community they are living in are adequate in number. Still, 1/5 of 65 plus older persons appreciate that there are not enough healthcare and social services according to their needs. We also observed that no significant differences appear between women and men with regard to the negative perception about the availability of social and healthcare services. However, older persons living in rural areas are in a larger extent less satisfied with the availability of social and healthcare services compared to respondents living in urban areas. Most of the unsatisfied older persons are pensioners, and a small percentage of them have other sources of income besides pension. Based on the level of education, respondents with a medium level of education are in a larger extent less satisfied with the availability of services compared to those with no or low education level, or in case of those with high education level. With regard to satisfaction about different types of healthcare services accessed during the last 12 months, we observed that most of the respondents received healthcare provided by family doctors or by a specialist physician. 12.4% received dentistry care, and 8.3% were in need of hospital care. For all the types of healthcare services, the level of satisfaction is high, but the highest level of dissatisfaction occurred in case of family doctors or hospital healthcare services. In case of healthcare services provided by family doctors, we observed that women were in a larger extent unsatisfied and very unsatisfied with the services received compared to men. Also, respondents from rural area were in a larger extent unsatisfied and very unsatisfied compared to respondents from urban area. With regard to hospital healthcare services, similarly to healthcare services provided by family doctors, women were in a larger extent unsatisfied and very unsatisfied with the services received compared to men. But with regard to a residence area, we observed that older persons from urban area were in a larger extent unsatisfied and very unsatisfied compared to those from rural area. With regard to satisfaction about different types of social services accessed during the last 12 months, we observed that a small percentage of older respondents received this kind of services. Among these, most accessed social services were home care service and social canteen, but for all the types of social and socio-medical services, similarly to healthcare services, the level of satisfaction is high. With regard to home care services, all the older females were satisfied and very satisfied with regard to the services received compared to 85.7% of older men. All the older persons from urban area were satisfied and very satisfied with the services received, and all the respondents aged 75 plus years old were satisfied and very satisfied with this kind of services. With regard to social canteen, both men and women were satisfied and very satisfied with the services received in a larger extent. All the persons from urban area were satisfied and very satisfied with regard to the services compared to 80% in case of older persons from rural areas. In our study, we try to understand the perception regarding the availability of healthcare and social services based on age, gender, residence area, income, and educational level. As the results are quite high in terms of limited or not enough social and healthcare services within the community, we may consider that there is an insufficient access to health and social services, especially in rural areas and for persons aged 65, 74 years old. Also, deprived respondents, those with income below the average old age pension, were more likely to have less access to social and healthcare services based on their perceptions with regard to the availability of services. Low income can influence access to health and social services, as other studies reported that a lower income decreases the possibility for people to focus on health and care. The respondents with a medium level of education expressed the most unfavorable opinion regarding the availability of services. National and international studies pointed to multiple individual factors that may constitute barriers to access to health and social services. The general appreciation with regard to healthcare services is positive, and other studies pointed to similar results. Family doctors, specialist physicians, and dentists were the most accessed types of healthcare during the last 12 months before the survey. The residence area had an influence on the level of satisfaction with regard to healthcare services. And for services provided by family doctors, the older persons from rural area express more misappreciation compared to those from urban area, while in case of hospital care, older persons from urban area are more dissatisfied with the quality of service compared to those from rural areas. With regard to social services, studies of Carino and also demonstrated that the level of education is a determinant of formal care utilization, as highly educated older persons 65 plus are more likely to receive home care. In this regard, the results of our study are in line with previous results. Studies and research conducted at national level in the field of older persons and quality of life in relation to socio-medical services reported high level of satisfaction with regard to services delivered. This work was developed under the Nucleu program supported by the Ministry of Research, Innovation and Digitalization, project number PN 1913-0401. Această lucrare a fost realizată prin programul Nucleu, derulat cu sprijinul MCID, proiect numărul PN 19-13-0401, titlul proiectului Strategii inovative de promovare a incluziunii sociale la vârste înaintate în contextul noilor provocări societale. Thank you very much for your attention.